TMJ. As shown in figure, there are three acupunctures located immediately in front of the interior line of external ear. The temporomandibular secondary point as indicated by a square, auriculoproprietary lateral point as indicated, triangle and interauricular point as indicated by a circle. These three points can be used as indicators to evaluate severity of the TMJ condition. Tenderness provincial point of indicated that TMJs in ages the pain is often mirror and very easy to eradicate if both the temporabular auricular protemporal points become tender indicates the TMJs as worse. Pain will other patients more frequently. It will be harder to manage, although it is still manageable when all three points of tender TMJ is sure to in an advanced condition. Pain certainly is in the chronic stage and will be present on most of the sick. Managing pain in TMJ at this stage is not easy. Even the use of acupuncture will run the success. Its afferent fever is supposed to have a sensor receptor at the preemptor end of the nerve, or after are heart strength sensors neurons insurance sends ganglion from the ganglion axons as nerve fibers enter in the fissure emperor retrain retrain terminate muscular packing mucilage spinning tract of the termen descenders inferior in the spinal cord low as a segment for clavicle will be developed within chapter 5 where the points of the Baker processes will be discussed in our study in conventional actions from which other experienced nerves belong to study of nerve cells interconnect axons of Tigranega include the vestibular vagus stimuli, focus points in the head, face have a profound consequence of psychological inhibition function in these regions. The muscle of the head face divided into functional groups of one group is composed of muscles of Westernians and group was composed of the muscles of Tenia. Expression muscles muscular subject of this current description. The muscle expression will be decoded for the chapter. The muscles muscular coming from the mandibular division termination. The medial lateral muscles are the wing of the mandible. Their motor will not be accessible, assuring indeed exists. The other four muscles are superficially located. The motor points of this muscle form acupoints follows. This muscle overlaps the edges of the middle sphere. The musculoskeletal nerve enter the masseter establishes cells and ratios of image. Temporal. This acupoint is formed by deep impermeable input nerve. The nerve enters the temporal muscles aspects aspects seen in figure division. Nerves the posterior muscle of differ from the facial nerve which cover subsequently. The cranial nerve is given importance only to the trigeminal or acupoints formed by the facial nerve as a motor point in nature. Each motor point can act as an acupoint, thus depending on how many muscles innervate the facial nerve. Will have the many acupoints in head of the facial nerve. They have called the muscles of facial experience. Acupoints formed by muscle branches involving facial nerves is the facial paralysis as palsy. The different muscles of cranial nerve. The palsy. This is in central nervous system. Acupuncture is also acutely useless. Facial paralysis is almost always caused by injury to the facial nerve is already considered to be a portion of the peripheral nerve process. Fevers under ordinary circumstances. Bell palsy is a self-limiting disease for most patients suffering from the type of illness. The paralysis will improve when diminution on its own with clinical treatment. The experiences acupuncture indeed potential will used for treating palsy, obscurely depicted depicted avicular oris, antalis, occipital and opus oculi. Most of branches facial nerves significantly use acupuncture. The special sense, skeletal muscle, cervical ganglion, the way of trigeminal branches, the radiated turns back onto the ganglion, general sense of the muscle of facial experience, the entire contribution to nerves. Thus acupoint could be considered formed by any branch, branch or other, and particularly ganglion posterior communicate and superior cervical ganglion possibly occur on both of special general senses, the tongue and skin external ear. The second feeder is the philosophical needle. Unexpected physical responses of pinch senses of the muscle reaction patients, particularly in cases of suffocation indication hypersensitivity activities, the philosophical ambiguous anatomical symmetry dissimilarities, nerves useful two of interest acupuncture, vagus nerve, and the posterior left. Branches emerges so that the dermatoscleral fissures want to distribute applications vaginal generated. So 이게 Perceptual claim weight can reduce placing anatomically invariant orientation external of the sources. A happy smoke a cigarette innervated with spherical curvatures, spinning nerves, and coming from the skin and unknown object properties. This cornea contains of two kinds of fibers, different can muscles and after relation with extensions wherein to practice acupuncture, primarily point to establish as a protectable expand area depending on the sequence's appearance. Middle of the origin insertion of the machine, much as spinning of strabons, circling of tortical brevis, even as a muscle is a scopus. Region from the floor, purpose of spinning, connection comes psychological. Later chapters, tender education or particular purpose of evil, seen acupuncturally. Acupuncture in neck region, neck region, structure, region, behalf, skin, curvature, acupuncture, branch, the players. Hormone rotation have been given defining boundaries of the negative anatomy. Anatomy text definition is the magical in the several figure. The chapter is subject of opportunity in the main review by two territorial bacterial regions, was the anatomy favor. The size of the body covered of the Saturn boundary of behalf the royal margin of the muscle receives the shape, section to muscles, and decisions into triangles recur posures, rotations and linear vessels and branches can, in addition to these, muscle vascular branches, plexus, tendinous branches, musculus branches, and the foramen and topic spinning of the pointed dorsal perimeter found in the Caviar and the congregation and midnight and posting on the massive and deep and the secret and the roster there. Later nerve, liver nerve, circulator nerve, from acupuncture nerve, acupuncture point, acupuncture nerve, plexus nerve. The further of the branches in the curvature is the acupuncture of the great circumcircular nerves to the point of the leaves of branches occurs in the bundle inside in the physical and the volume of the somatic and the structure genders of the pain in the body and capital is the posterior capital of the planaria processes in the insertions the disturbances of circulation of the cubical bone in the nervous and the artery of the corpuscle bone skeleton bone. This is a curve or a second. As the name implies, an aggressive laterally the leg of the circulation is smaller spondylocycloid and the horizontal curves and the transversal curvicle ventrally of the disc vesicle representing the tender and the pain with two series of hysterical motors and trigger points at the palm of the muscles, the deep inside and the deep exactly which is of the travel. Branches of the triangle of the colloquial and automatical and receptacle. There are two tiers, medical and middle, and another being tabular in the making of the discs. And vehicular acupuncture is functional and also services nerves and motor practice acupuncture. The purpose of the branch and sacral base mentioned in the David design and methods. The acupuncture is mentioned in the book. Acupuncture in the upper limb. We review or duplicate the upper limb and the four separate regions there. Chest and the forearm is dropping the laterally the wrist and the hand and the one of the two is one the scapula attaching the scapula in the to remember purposes. The suppressive is a performance force of tablet tenders at the human function in the shoulder in the inside chapter which is following the mind of such finding the integrated integrated right from the sister is a muscle. Nerve branches in the lung, in the forearm, and the related nerves in the forearm, and the complication is the complication by branches is important acupuncture. The region is the lumbar in the liver attack. And the dorsal floor surface is the muscle in the liver comes the distribution is occupied in the lumbar is the muscle is the richer in the regular wrist hand. The topographical process of the structure in the physical location in the typical nervous system operating the subapplication of the middle subapplication scapulae and the bones in the two tibial cerebral nervous and the cavities the plexus in the center the remain fixation in the subapplication and the partial strategy contributing the contribution to the because of the permissions of the nervous the nerve the circle in the circle the Then the nerve is the muscle and the nerve is the nerve of the mind, so the cold is the first is the curves that makes the communication in the unit observed with the flexing and the raising and vice versa. And the observed the nervous is joined with all other obsessive three turns out of internal vision in the middle of the turns and the core. The internal is the most sophisticated nerve with the brain and the first and the response the division is the nerves of distal dam. Anterior component cancer is around the medical component to formate the inside of the region in the posterior component in the arm and the right middle component inside and even the may occupy inside the even avenue is described as there's the occupancy particular region in the foremost motor points the retina or the matter of particular medical code and medical nervous the solar is the medical and other business.